Hi there, students, and welcome to Crazy Nurse RN channel. I'm Criselmer Ducanes, a nurse educator teaching fundamentals of nursing practice. If you have any question or if you want to clarify some gray areas with regards to our topic today, please comment down below. I'll be glad to answer your questions and read your comments. Also, if you want to suggest any topic or content for our next videos, please also write them below. And if you find this YouTube channel useful, please click the subscribe button and hit the notification bell to keep you updated for new video uploads. So today our topic is about documentation focus charting. Okay? So what is documentation or documenting? It is also known as recording or charting. It is the process of making an entry on a client record. We also have here charting practices that help decrease liability risk. First, use nursing process to guide your documentation. So in writing your documentation, especially in your focus charting, we have to apply the principles in your nursing process. So that is your assessment, diagnosing, planning, implementing, and evaluating. Number 2, be sure to chart significant events and ensure your charting reflects agency standards. So we have to follow the healthcare institution's agency policy in documentation. Always chart that you have notified the physician of a significant change in a client's condition. This is a very important aspect in your charting or in your documentation. Chart legibly and use correct grammar and spelling. Okay? Chart objectively, avoid assumptions and stick to the facts. Okay? Nurses should be reliable and accurate in documenting or charting patient's care. Avoid portraying a client in a negative way. 7. Do not chart care in advance. Okay? So after you have done a nursing intervention, you have to document it. Okay? Do not chart for anyone else. You are responsible with your charting or your documentation. Countersign with caution. Okay? So before you affix your signature or your name there in your documentation, make sure you have read your documentation and you have seen that these data that you have written are true and reliable. Okay? That avoids nurses to any legal charges. Okay? Do not wait until the end of the shift to chart. Okay? As what I have mentioned, once you are done with your nursing intervention, you have to immediately document it. Okay? 11. Follow your agency's policy regarding late entries. So each healthcare institution has its own policies or guidelines on how to manage if you have late entries in your chart. Okay, so please be familiarized with those guidelines and policies with regards to late entries. And lastly, number 12, never alter a medical record. Okay, remember that your medical record, your patient's chart, is used as an evidence uh, in legal courts. Okay, so make sure to never alter. Okay, make sure that you should not have any erasure or that you didn't that you do not tamper any data in your patient's chart. Okay, so we have here words that will help in charting. Okay, So as what I have mentioned, your charting reflects your nursing process. So I have here lists of words or verbs that might be helpful in your documentation. So if you are writing for an assessment, you can use words like describe, state, determine, let the client state, verbalize, identify, indicate, evaluate, examine, find, note, observe, list, review, watch, question, clarify, monitor, assess, check, take, ascertain, examine, look, explore, inspect, and investigates. So these terms or these words are used if you want to convey an assessment. We also have implementation words, okay? So do, implement, elevate, attach, position, place, give, reinforce, hold, help, keep, provide, use, record, supply, treat, administer, apply, maintain, weigh, promote, measure, assist, explain, limit, increase, perform, decrease, put up, turn, demonstrate, change, cleanse, ambulate, and prescribe. So these terms and words reflect your assessment, your implementation phase. Lastly, we have health teaching. So if you want to convey health teaching as an intervention, so you may write or you may use words such as report, refer, advise, educate, instruct, teach, demonstrate, provide information, produce, conduct, enumerate, discuss, explain, encourage, stress, promote, enlist, consult, introduce, point out, furnish, continue to, make appropriate referral or follow up. So these terms are used if you want to write about health teachings. Okay? So we have here focus charting. So what is focus charting? So it is intended to make the client and client concerns and strengths the focus of care. So it provides a holistic perspective of the client and the client needs. So the format that we will be using when we write focus charting in our patient's chart. So we have here three columns. Okay, we have the first column, we have the date and time. Second column, we have the focus, and the third column, we have the progress notes. Okay, each one of these will be discussed in the following slides. Okay, so for now, I have here an example how it looks like. So as what you have mentioned, we have three columns. Okay, we have the date and the time. Then after the date and the time, we have the focus. Okay, then after the focus, we have the progress notes. Okay, your progress notes includes your data, your action, and your response. So I'll discuss each one of these aspects or sections in the following slides. So just to present to you the format that we will be using in your focus charting. So we have three columns. Okay, so what is the focus section? Okay, which is the second column in the format. So focus, it may be a condition, a nursing diagnosis, a behavior, a sign or symptom, an acute change in the client's condition or a client's threat. So going back to our examples, so we have here focus. So the problem of your patient here is nausea. Okay, so you could write nausea there. Okay, so if your patient has a problem with his or her thermoregulatory function, so the patient has a fever, for example, so you can write fever or increased body temperature there in your focus. So it depends on the problem of your patient. Okay, uh, in your focus you must be specific. Okay, so we're done with the focus. Now let's proceed to the progress notes. So are organized into, we have data, or it is written as D. It reflects the assessment phase of the nursing process. Okay, so here in your D you write your assessment findings. A, or your action, reflects planning, implementation, and includes immediate and future nursing actions. Okay, so basically your action section comprises your nursing intervention. We also have your response, or R. It reflects the evaluation phase of the nursing process and describes the client's response to any nursing medical care. Okay, so these reflects your evaluation phase. Okay, so going back to the examples that I have presented to you earlier, so we have here, so we have written the time, the date and time, the focus, and the data action response. So as you notice, under your data action and response, that's your progress notes column. So D, I feel like my stomach is filling up with pressure again and I'm nauseated. So that reflects your assessment findings. Okay, so remember your assessment findings has your data has two types. We have your subjective and objective data. In this example, it is an actual verbatim from your patient. So it is considered as an objective and as a subjective data because it comes from the patient. However, if you have your own assessment findings, so that is objective data. So you could include or you could add to your assessment findings. So it is good that you have both the subjective and objective data in your assessment findings because that gives a strong evidence or a strong support uh, with your problem. Okay, so remember that one. So here in the example, it is good that we have subjective data and objective data. So in your objective data, abdomen round and soft, gastrostomy bag at body level, rare bowel sounds. Okay, that is your objective data. Okay, so we'll proceed with A, or the action. So it means these are your nursing interventions. So we have here gastrostomy bag lowered. So it's an action. Okay, it's a nursing intervention. Then after that, we have the R, which means response, which reflects your evaluation phase in your nursing process. So we have here, I feel like better now. So that is a subjective data. So that can be used as a response in your patient. And we also have an objective data response, approximately 200 cc golden fluid returned as much flatus. So that is an objective data. So as you could see, your data that you have written earlier uh, was being evaluated in your response. Okay, so that means your response is related to your data. Okay, so we'll proceed now. So focus charting the application of your nursing process. So it addresses the client's addresses the client's problems or needs and includes a column that summarizes the focus of entry. So D stands for your data that reflects the assessment phase. A stands for action, the implementation phase. R stands for response, the evaluation phase. So how to write focus charting? So depends on the healthcare institution policy. Okay. So each institution or hospital has its own policy or guidelines when it comes to writing your focus charting. So here, I'll be discussing to you the policy and guidelines on documentation based on St. Paul's Hospital of Iloilo guidelines and policy. So we have format number 1 here. It's a 12-hour morning shift. So when we say a 12-hour morning shift, it means that the nurse has its duty from 7 a.m. until 6:59 p.m. Okay? So in this slide, I will be presenting to you a documentation made by a nurse who who has a 12-hour morning shift. Okay? So we have here a sample focus or DAR charting. So as you can see, we have the date and time, we have the focus, we have the progress notes. Okay, so try to focus your attention on the date and time column. So we have here March 12, 2020, and we have there 10. Okay, by the way, as you noticed, we also apply the color coding of marking ink here. Okay, since the duty of the nurse is a morning shift, okay, from 7 a.m. to 6:59 p.m. So he or she will be using the mark ink, the black ink, sorry, the black ink. Okay, so everything here should be in blank with some exception. Okay, so I'll later discuss to you that exception. Okay, so going back to the date and time, so you write March 12, 2020. Then you write 10. What is 10? That means it's the time. Okay, so no need to write AM or PM. Okay, because it is understood that when it is written in black, it means it's 10 a.m. Okay, so just have to write 10. Okay, so we have focus, the focus or the problem. So the problem of the patient identified during the shift is post-operative pain, meaning the patient had pain after surgery. Okay, and this pain was noted or was identified by the nurse at 10 a.m. Okay, so that is why he wrote 10 there in the date and time section. Okay, okay, now we'll proceed with the progress notes. Okay, as what I have mentioned, we write the progress notes based on three sections. We have the D or your data, we have the A or your action, and we have the R as your response. Okay, for your D, it reflects your assessment phase. Okay, obviously these are the statements of your uh, assessment findings, okay, based on the problem that you have identified. So as an example, so I will read to you the data or the D under your progress notes made by the nurse. So complaints of intermittent pain at the incision site located at the left hip, rated as 5, tolerable pain using the 10-point numeric pain scale, facial grimacing, and left extremity muscle guarding noted. Okay, so as you noticed, these statements of assessment findings are reflected or are based on the problem identified. Okay? So, as much as possible, you need to be more comprehensive or thorough in terms of your assessment findings so that the person who will read this charting will have a clear picture of your assessment. Okay? So that's your letter D or your data. Then after enumerating your assessment findings, you need to proceed to your action or your A. So as what I have mentioned, these are all nursing interventions, dependent nursing interventions. Okay? So here we have encouraged to perform deep breathing exercises 10 times per day. Turn to turn to right side with abduction pillow in place, assisted with guided imagery and biofeedbacking provided with calm and therapeutic environment. So I'll stop there first. Okay? So as can be seen, those statements that I have mentioned are purely independent nursing interventions. Okay, so this means that the first statements that you will be writing under your A section should be your independent nursing functions. Okay, and also as you noticed to the manner or to the format that these statements are written, these are all fragmented sentences. Okay, so in writing your DAR charting, you do not need to write a complete sentence, only a fragment sentences, which can be understood by someone who will read your documentation or your charting. Okay. Also, it is written in past tense. Okay, remember that one. It should be written in past tense because the nurse had already performed these procedures, and now he is actually writing this documentation or this charting. Okay, so that means it's done already. Okay, and also each fragmented statements or sentences or sentence should be separated with a semicolon. Okay, remember that one. It should be separated with a semicolon. Okay, so let's continue now the action section of your DAR charting. So we have there Dr. Alcala, MROD, notified and ordered celecoxib 200 milligrams per tab, 1 tab given per orem as stat dose. Okay, so we'll stop there. So as can be seen, that statement that I just read is is an in, is a dependent intervention. So when we say dependent nursing intervention, it means that you need a doctor to order that particular intervention, okay, for you to perform. Okay, so in this case, the doctor was notified and ordered the following medication. Okay, so that's it. So after writing your nursing interventions or your independent nursing interventions, you have to write your dependent nursing intervention. Okay, and also as you noticed, Dr. Alcala, MROD. By the way, MROD means medical resident on duty. Okay, so the name of the doctor should be in the opposite color or marking ink. Okay, in your charting, we are using two inks. Okay, so we have the black and the red ink. So either way, you have to use opposite color when you mention the name of the doctor. Okay, so there. Then lastly, you have to end your action section with a statement like monitored for progression of pain and altered vital signs. Okay, since we are focusing our problem to post-operative pain, So we have to monitor for progression of pain and altered vital signs. That is a very good statement when we end our action section. Okay? For example, if your patient has a problem with cough, so you could write there as your last statement in your action section, monitored for progression of respiratory distress or deterioration of patient's respiratory function. Okay, so make sure to write that one referring on the problem that you have presented, which is cough. Okay, then after that you have to end your statement with a period. Okay, so that means that is the end of your charting or your documentation under your action section. Okay, so now we're done with your A in your DAR. So let's proceed with your R. Okay, so here you have to write again the date and the time. Okay, so it's very important to write the date and the time because we want to evaluate, because we want to know what time did you evaluate your patient. Okay, so in doing your charting, we usually end our or closed our charting 1 hour before our off. Okay, so for a morning shift, the off time is 6:59 p.m. So 1 hour before that, we have to close your charting. So here the nurse wrote 6. That means it's 6 p.m. Okay. So now we will have to write our R, which means response. So it reflects the evaluation phase of your nursing process. So we have there pain level decreased from 5 to 1 based on 0 to 10 pain rating scale, no facial grimace, no muscle guarding of the left extremity noted. Okay, so as you noticed, we are actually evaluating your data which we have written earlier. Okay, so that means your R reflects your data. Okay, what you are evaluating in your response or your R is the data that you have presented earlier. Okay, so that's it. So that's how you write your focus charting and your DAR. We also have to uh, separate each fragmented statements or sentences with a semicolon, then a period at the end of our statements. Okay, after that you have to write your full name, then comma SN slash SPU Iloilo. That means you are a student nurse, so so you have to write SN. Okay, means student nurse, then slash your school. Then after that you have to affix your signature over printed name. Okay, so that's it. So that's how you write your focus or your DAR charting. That's a format number 1 for morning shift. We also have format number 2 for 12-hour night shift. So that is from 7 p.m. to 6:59 a.m. Okay, so it's still the same. However, we used red ink here. Okay, so as you notice, the name of the doctor was written in the opposite ink. Okay, so the same thing. However, it's written in different color based on the time the nurse has his or her duty. Okay, we also have your format number 3. This is your multiple problems. Okay, so for example, your patient has a lot of problem during your shift. Okay, so we have here at 10 a.m. the patient has a you identified that the patient has a post-operative pain. So you have to write the D, your data or your assessment, the A for your nursing interventions, and you do and at 11 p.m. you identified that the patient has fever, or the patient had a fever. Okay, so you have to write the D for your increased body temperature, so with 38.9 degrees Celsius of body temperature, etc. Okay, then you write your A, okay, your actions or your nursing interventions. Then by 1 p.m. you also identified that the patient has cough. Okay, so you write there D, so expectorated to approximately 30 cc of whitish sputum, etc. Okay, then you write your A, your actions or your nursing interventions for that problem. Okay, so now it's time for you to evaluate for your response. So you have to write the date and the time. Okay, so as what I have mentioned, it is usually written by 6 p.m. if you are in a morning shift duty. So we have their response for R. So you need to evaluate each problem here. So first we have here pain level decrease from 5 to 1, etc. So that's your first problem evaluation. Then, secondly, we have here body temperature from 38.9 degrees Celsius to 37.5 degrees Celsius. So that is your evaluation for the second problem. Then last, we have your with occasional productive cough. So that's your evaluation in your third problem. Okay? So remember, each fragmented statements should be separated with a semicolon. And for your last statement, you have to end it with a period. Okay? So in a nutshell, those data and those responses should have a date and time. Your actions or your nursing intervention should not be timed or should not be dated. Okay? So that's a general rule in your uh, focus charting. So in this multiple problems format number 3, we have come up with a pattern da 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 dar. Okay, so that can be used, especially if their patient has a lot of problem during the during your entire 12-hour shift. Okay, then after that, once you're done with your charting, you have to write your name, then comma SN slash SPU Iloilo. Then you affixed your signature over printed name. Okay, so that's how you write your focus charting for multiple uh, problems. Okay, so now I'll be giving you exercises. It is the concept application of what we have discussed earlier for me also and for you to evaluate yourself on how to write a focus charting or a DAR charting. So I hope you learned something today. So thank you so much